I'm Dr. Yoon of Northwestern University. My poster is on my research looking at late onset scleroderma renal crisis. Scleroderma renal crisis, or SRC, is a rare but life-threatening complication of systemic sclerosis with one-year mortality rates ranging from 18 to 30%. SRC is considered an early complication of scleroderma, expected to occur within the first 4 years of disease onset. However, case reports in the literature show that SRC can occur late in the disease. Little is known about this late onset phenotype of SRC. The objective of my research was to identify risk factors associated with late onset SRC and compare clinical presentation and outcomes between late onset and early onset renal crisis. This was a retrospective case control analysis of SRC cases seen at Northwestern Medical Center between the years 2000 and 2019. We had a total of 48 cases, of which 6 were late onset, defined as occurring after 5 or more years of disease duration. We compared late onset cases with early onset controls to assess for differences in demographics, autoantibodies, comorbidities, recent medications, SRC presenting features, and clinical outcomes. In our cohort, the late onset group developed renal crisis at a median of 8.5 years after scleroderma onset, while the early onset group had a median disease duration of 1 year. We found that late onset SRC cases was significantly associated with positive RMP antibody compared to early onset controls. Looking at medication use in the 1-month period prior to SRC, we found that prior ACE inhibitor use and corticosteroid exposure was significantly associated with early onset SRC, but not late onset SRC. Another significant difference between the two groups was in the proportion of patients presenting with hematuria, which was present in 75% of early onset cases compared to none of the late onset cases. And finally, looking at clinical outcomes, we found that 50% of patients in both groups had dialysis-free survival at the end of the hospital admission for SRC, with no significant difference in the risk of death or dialysis initiation between the two groups. In conclusion, 12.5% of our total SRC cohort had late onset SRC, highlighting the importance of considering SRC on the differential for any scleroderma patient with acute renal dysfunction, regardless of disease duration. Additionally, we found that positive RMP antibody may be a risk factor for late onset SRC. Thank you.